A very good day, my dear postgraduate students and junior faculty. The topic on the screen is not only a question for the postgraduates, but also a highly technical one, difficult to decipher, but worth its weight in gold. And all the credit should go to Dr. Stephen Peters for this amazing presentation. The cryostat. You people should be aware of it, and the sections are usually around 6 microns, though it might be thick as much as 10 to 15 microns for various purposes. The temperature range is given over here, minus 15 to minus 27 degrees centigrade. And these are all the uses of the cryostat. You people should be able to rattle it off. 1. Rapid diagnosis. To see the margins for malignancy. Demonstration of fat. Enzyme histochemistry. Immunohistochemistry. The antigens are better retrieved. Tetracycline labeling in non-decalcifying substances. Molecular procedures. So this is a list that you should have in hand. My purpose, of course, is to the technical aspect of it. These are again the significance of it, and the frozen section by itself can have some disadvantages such as a poor quality section, artifacts, a great deal of skill and expertise is required, and optimal cutting temperature is needed. Not only within the room, but within the instrument also. Kindly memorize this. And these are the lists of recommended temperatures. I would like you people to kindly go through. At the most, you might be asked what is the temperature. And these are the parts within. It is in fact described by Culling as a refrigerated microtome. And on the screen, I am seeing a quick freeze stage for freezing the specimen, a block holder, and a microtome with a knife over here. There is also a brush stage by the side and a stage for keeping the fixatives. There is a keyboard for seeing the temperature, etc., and to operate it. And this is a beautiful saying by the author: leave the cryostat the same way as we leave a bathroom. It should be clean, neat, and dry. The basic starts with a sharp blade. Leica is again one of the beautiful companies. I am not a marketing person, but I could not help it. Start with the best quality blade and do not save money on that. Penny wise and pound foolish. The change occurs when the quality falls. This improves when you change for a better blade. And again, we should not be this. And imagine that hundreds of dollars are spent on gloves, lap pads, BP apparatus, cuff, etc. But for an ordinary blade, we hesitate. And this itself, this is a block holder, the other parts of it I will be saying. And there is a knife over here. At a higher magnification, it should be well adjusted, lubricated, so that there is a flawless movement. And it should be facing the blade. The blade is over here, and this is an anti-roll plate. It should be almost parallel to it. The X and the Y axis are well controlled by means of the screws over here. So much so that when you place the block, there should be a minimal trimming because the tissue is extremely precious. And secondly, there should not be any infection or cross-contamination. Please, students, remember that this is a microtome itself. Just as in a microtome, you can have the foreign substances or tumors, etc. This also can carry it. And there are some centers where the cryostat is being used left and right. Extreme caution is needed. So there has to be a minimal transmissible disease, and that we should be aware because this is not put in formalin, and hence it has got a capacity to carry the HIV or even the tubercle bacilli. The safety tip. The blade should be used on one patient, that is one sample used for, and it should not be used for several days. And there can be annoying scalpels. So these should be got rid of and a better one used. And what the author says is when you sit on a stool, you cut a better section. Standing is like standing on thin ice, likely to collapse. You should be relaxed and comfortable. That is what he comments about the posture. Now look at this picture over here. Again, an anti-roll plate. There has been a movement and the section is being cut. This is the brush over here. It has got its own purpose, which I'll be saying. So it lifts it up and it has to be a very parallel movement that will be emphasized upon. The brush. You should be learn to be good with the brush. So there is an anti-roll plate as I had mentioned. And this is almost like a child walking on a crutch. It should be able to stand on its own and start walking. There is a maneuver and there has to be a little bit of a grip on the brush. And in this case, you find that it has been angularly cut so that it serves the purpose. Temperature has to be maintained to avoid the curls. And the tip has to be angulated. It can be firm but not flimsy. And the clean brushes are used with either soap or ethanol and later on with xylene and cool. So this is the Chinese bore that has been used for making the brush for a cryostat. And this is what the brush stand I said. Look at the panel of brushes and the forceps that you people have got. These are extremely important, sensitive. It is as though a doctor is carrying his own strength. Holding the brush and turning the wheel. These are two simultaneous movements which should be performed synchronously. The left hand stabilizes and there has to be a great deal of dexterity or a firm movement and there is a turning of the wheel which should be continuous, uniform, without hesitation. No jerk should be there. Simultaneously, there should be the movement of the brush, etc. And with practice, you find that the operator is able to move both of these. That is exactly what is being shown over here. And it is being removed, the movement goes on. The quality of a man's life is in direct proportion to his commitment of excellence. Tom Landry, a very beautiful saying, and the entire procedure is not mediocre but an excellent one. Retrieving the section. Look at this one. It is a relay race that is over there, and you find that the person who has run is now handing over the baton to the next person so that there is a very smooth handing over and taking over, yet the race continues. And that is exactly what is happening over here. The brush as well as the knife and then the external adjustment, the movement, all should be very synchronous. Synchrony is the word for it. The bicycle is a beautiful example that the author has given. So there is a movement, there is a balancing, and there is a moving forward also. It has to be continuous and repetitive. So these are the things that has to be made. So how they cut it and then the wheel is being moved and it is being retrieved from the block are all the steps that are shown over here. A rapid fixation. This indeed is required. After all, the process is supposed to be rapid. So it is placed in 95% ethanol and the delay will be causing an artifact. And the slide will show changes. Look at this. This is a case of a bronchoalveolar carcinoma. There has been a drying artifact over here, whereas this appears quite normal. Similarly, the kidney tubule. You find this section is quite pathetic, whereas here, after fixation, you find that the details are well brought out. The thickness of a section, we had already mentioned. You find that if it is going to be too thin, there can be nuclear holes because of the artifact. And you find that it should not be too thick also. But thicker sections can offer better details to the pathologist because of the ample amount of tissue. So this is a kind of a punch biopsy of the skin wherein one bit has been taken and that is given. And these are all the margins over here. The way it is to be cut has been described well. We should be careful so that the the epidermis does not come up from the subcutaneous tissue. Epithelium should be first perpendicular and it should be diagonal to the knife. When did the tissue fail? Orienting to the knife. When it is too large, there is a drying artifact, blunting of the knife, and it is in 100% ethanol. 95%. See, the 5% makes a huge difference. And this is exactly what is going to happen. It is the opposite of it. There is a great heating of the environment and there is a melting of the Arctic. How much tissue can be there in a single block? Large bits are there, so much so that they will have to pass through the knife. Depends on the blade, depends on the flexibility. Liver, kidney are all easy tissues, whereas skin and collagen are tough. When there is too much of stress, there can be alternate thin and thick sections which are not good. And warming can help us to warm the block itself. You should listen to what is happening. Listen to the block. The highest brittleness of the tissue will be giving a scratch sensation. And there can be grating and vibrating noises which we shall hear, not only see. Trimming the block. As I said, if you trim too little, you find that there will be no critical feature. And if too much is being trimmed, all the details can be lost. So there has to be a margin of it which has to be done. Look in this case, both of them look almost similar, but then the margin is quite deep within the eyes, whereas here it is well brought out. So it is ideal. So these are the references. I would like you people to kindly go to them. Temperature of the block. It should not be too cold or too warm. And you find that there should not be any curling. When it is too cold, there is something like the Venetian blind that is over here. Look at this one, it exactly matches it. And I'm finding artificial cracking of the tissue. So there has to be a cryo-embedding system, almost at the same temperature. Sometimes freeze sprays are being used. And you'll have to pick up the right section. Thickness is a judgment. So look at this over here. There are 3 microns thick, 6 microns, and 10 microns. Whatever you need, you will have to decide. When it is too thick, you find that there can be a loss of the cellular details. Or when it is too thin, it might not be adequate. So that has to be judged. Shattering of the sections. That is exactly what is happening over here. On this side, I am not able to see the details. Here, the renal tubule, etc. is normal. This is a carcinoma. So when it is too cold, the water content, edematous body fluids, and brain biopsy itself is notorious. That is why some people prefer squash preparations. Kidney for its water content, and the tumor becomes harder and icier. It is almost equal to a glass which cannot be cut. Shattering. So this is what? There is some kind of a compression and you find that there is a break in the tissue. So this is also over here, whereas it is relatively better in this form. Stripes on the section. So you find that there can be. This is exactly what happens when there is a nick in the blade. A nick in the blade is a small depression or a foreign body, and however many sections you cut, you will be finding that these lines will be there. Also, there can be some calcification in the tissue. These are all, dear students, very highly technical topics, but it is worth you people listen to this and then write the answer on your own. So it is almost like a torn cloth. The wavy lines we had already mentioned. This can be because, see, these are all the screws over here which fix the block, and then there is a knife holder almost similar to a microtome. All these should be very tightly fixed. So any movement in the system, any vibration will be there. And if the instrument itself is not proper, it needs servicing. And there can be a holing in the blade. Knobs, knife holders, stage, everything must be checked, should be tight. So these are all the things. Fat, it must be removed. In the sense, it has to be trimmed as much as possible, but at the same time, we should be careful. Supposing it is a axillary breast tissue, it can be having an enclosed lymph node that should be there. And it has to be a cold block, the movement has to be swift. See, in this case, there has been a fat in which there has been a tumor also that has been. So all fat should not be thrown away. The importance of fat. Here I find that there is too much of artifactual change. This is the best of it. And in this, there is a tumor that has been identified. Plastering technique. Sometimes you find that there can be material that has to be removed. So there can be retraction, etc. And then this is made up by means of the embedding medium. So there is a super flat embedded specimen that is over there. And it can be again fixed by means of other substances so that when I do take a section, it has to be perfectly flat. I have to get representations of all the entire tissue. Similarly, removing a foreign body. It can be stapled in some cases. So this will have to be very delicately removed and the hole again fixed with the fixative over here. And the cutting continue. And so also removing a suture. So here I find that there is a lot of these lines. Ultimately, I find that there is a suture material. This has to be removed. It has to be fixed with the embedding substance. And it is almost similar to removing a foreign body from a suture site. The sample preservation is very much needed because it has to be sufficient. Insufficient will not be adequate. At the same time, you should retrieve the material for flow cytometry, for culture, or for genetic studies. Touch preparation can be used in a case of lymphoma. Epithelial, it will be cohesive. Lymphoma, it is discohesive. And glial tissue, it is recommended because of the fibrillarity of the cytoplasm. And these are the wonderful references over here. To be frank, it is from Ackerman, etc., that the author has mentioned, which you should see. Limitations. Rushed and we are forced to commit mistakes. Always a pressure is on us in the form of turnaround time. Grossing itself can sometimes take time when we are looking for the margins and other things which has to be inked. There has to be too many cases, that is why it should be well organized. Edges should not be trimmed too much. Look at this one, a bad frozen section, a frozen section with a control, and then this is not a frozen section, and you find that there is so much of a difference in the morphology. Limit the stains, and then has to be a consultation with the clinician. Freezing artifacts to be avoided. Ice crystals can lead to a bubbly storm. A compression artifact is also there because of the expanding bubbles or the edematous tissue. This is collagen over here, and then this is the renal tubule. Look at this one, and this is not frozen. There is so much of a difference in the morphology. How can I give a report on this section? Thinner the section, greater the holes or artifacts. Sometimes we think only the thin sections are needed. Here you find that there are too many holes which is not found in the normal one. Similarly, in a connective tissue also, there are too many holes in the nuclei which can be artifacts. Look at the nuclear chromatin in the frozen one. So this is a permanent section in which there is a vesicular nucleus, whereas here it becomes artifactually hyperchromatic. So avoidable limitations are drying artifacts, we can avoid sampling error, we can avoid fat, we can avoid the qualities of the section, inconsistency. Always a trained technician instrument is needed, and the process of embedding is extremely important. Excellence is the gradual result of always striving to do better. Fat relief. And the conclusion is one must know what excellence looks like, and we should start moving towards it. One can only achieve excellence if they are aware of all the mistakes. And this is the opposite of the frozen section. The melting Arctic snow, one day the earth will be covered with water. Thank you.